Planned Parenthood has recently been under fire after a series of undercover videos were released by the anti-abortion organization, the Center for Medical Progress. Opponents of Planned Parenthood have used these videos to accuse them of selling fetal organs for profit. According to the Center for Medical Progress, if the accusations are true, Planned Parenthood would be breaking federal law. However, Planned Parenthood claims that they haven't broken any laws.
The allegation that Planned Parenthood profits in any way from tissue donation is not true.
The organization accuses the maker of the videos of editing them to sound out of context. The videos have been extremely controversial and have spurred Congress to reconsider their funding. Federal government must continue to fund Planned Parenthood. Today, Planned Parenthood has become an increasingly important part in providing healthcare to low-income and rural populations. Planned Parenthood provides health services to over 5 million people in the country.
It is a myth to think that if we were able to defund Planned Parenthood, that there is the capacity to provide the medical services to the women who are being served in the lab.
Selling fetal tissue for profit is illegal under 42 U.S. Code 289G-2, but it does allow Planned Parenthood to donate fetal tissue for research and receive reimbursements for storage and transportation of the tissue. These fetal tissue donations are essential for stem cell research and developing vaccines.
Fetal tissue has been used for 50 or 60 years. For example, many of the vaccines that many of us have taken, smallpox vaccine, the rubella vaccine, things like that, were developed, either the research was done using fetal tissue, or sometimes the vaccines themselves are grown in a medium that consists in part of fetal tissue. It's valuable because of its potential for growth, and because it can become lots of different kinds of tissues.
The recent controversy has prompted some political officials to reconsider the funding of Planned Parenthood.
Planned Parenthood provides many reproductive health services other than abortions to low-income people who would otherwise not be able to afford it. According to Planned Parenthood, abortion makes up only 3% of their services. 865,721 pap smears and breast exams were performed in 2014 to 2015.
I think most of the people in Rockville that we saw were there for health services such as pap smears. We provided very low cost contraception. So between general gynecological care and access to birth control, I would say that was what we were busiest with there.
Planned Parenthood provides contraceptive and other reproductive health services to over 5 million men, women, and teens. 2.7 million women visit Planned Parenthood regularly for healthcare services and information. 80% of clients get pregnancy prevention services.
Mostly what I did was counseling women who were pregnant, they just found out, and they were thinking about having an abortion. And there are certainly rules or protocols that we followed. Have to tell them, of course, all their options of adoption, having the child, or abortion.
41% of Planned Parenthood's funding comes from the government.
So most of the funding that they're talking about, what Planned Parenthood really gets from the federal government, is Medicaid funds for non-abortion services that they provide for poor women. And just as any Medicaid provider should get funded for those kind of services, so too should Planned Parenthood.
Planned Parenthood services help prevent approximately 516,000 unintended pregnancies each year. If federal funding is taken away, Planned Parenthood won't be able to provide as many services as they do, and many low-income people will lose these essential health services.
As governor of the state of Florida, I defunded Planned Parenthood.
Opponents say that an organization that carries out abortions should not receive federal money. However, the federal funds that they receive don't actually go to abortion.
There's no federal funding for abortion. And so if the effort to cut off funding for Planned Parenthood would succeed, we would cut off contraception, but we would not cut off abortion.
The truth is that women will have abortions whether it's legal or not. And the answer is whether or not we're going to protect that right and make sure women feel safe and that they have a safe place to go for the care that they seek.
Anti-abortion activists use these videos to support that Planned Parenthood's use of fetal tissue is illegal.
Planned Parenthood's practice of brutally dismembering young and defenseless human beings is outrageous and atrocious enough.
Anyone who has watched this videotape, I dare Hillary Clinton, Barack Obama to watch these tapes.
But Planned Parenthood donates it and receives money compensations for storing and transporting, which is not against the law.
Valuable consideration does not include reasonable payments to cover certain costs associated with either fetal tissue or organ donations.
They only were reimbursed for the costs of providing the service in terms of the tissue donation and not making money off of the program at all.
Opponents feel that the PPFA has become a multi-million-dollar organization on the backs of taxpayers. But taxpayers are actually helping to reduce the amount of abortions since the organization promotes family planning and contraceptives.
Well, Planned Parenthood's contraception services are tremendously valuable. Clearly, as their name states, Planned Parenthood leads to better outcomes for mom, leads to better outcomes for the baby. Unwanted pregnancies take a terrible toll in this country, and it's something that can be addressed. Often, one of the key obstacles to avoiding unplanned pregnancies is lack of education and lack of access. Those two things are two of Planned Parenthood's primary missions.
Abortion ultimately saves the public's money since it results in fewer children on welfare.
They do more to prevent abortions than any of the anti-choice groups because that's how you reduce the number of abortions in this country.
Planned Parenthood must continue to be federally funded because it provides a multitude of health services to low-income people who otherwise would have no other option. Planned Parenthood isn't all about abortions. They are mainly focused on the general health of women.